name is Mackenzie. I'm a physician assistant student. The purpose of your exam today is to get some vitals, assess the skin, head, ears, eyes, nose, throat, and neck.
Okay.
Before we get started, I'm going to have you remove your shirt, your shoes, and your socks for proper visualization. And while you do that, I'm going to go ahead and wash my hands.
Okay.
Alrighty, and I'm noting the presenting appearance and general health status. I'm noting that the apparent age matches the stated age. I am noting the grooming, hygiene, and any body or breath odors. I'm noting the body habitus and any obvious physical deformities. I'm noting the posture and motor activity. I'm looking at facial expression for any pain or distress, and I would perform a mental status exam at this point. Now I'm going to take your height and weight.
Okay.
And now I'm going to get an oral temperature. Alrighty. I'm going to place this under your tongue for 1 minute or until it beeps. And while we're waiting for that, I'm going to check the radial pulse for rate, rhythm, amplitude for 15 seconds, and then I'll multiply by 4. And keeping the same position, I will count the respiratory rate for rate, rhythm, and depth for 15 seconds and multiply by 4. Alright, let's do this. Okay, good. Alrighty, and now I'm going to get your blood pressure. First, I'm going to measure that the width of the bladder of the cuff is about 40% of the circumference of the arm, and that the length of the bladder is 80% of the circumference of the arm. Alright. I'm going to palpate the brachial artery. And I'll place the cuff 2.5 centimeters above the antecubital fossa. Alright. I'm going to get a palpable systolic pressure first. Then I'm going to reinflate the cuff to 30 millimeters of mercury above the palpable systolic pressure. I'm going to listen for the first carot cuff sound indicating the systolic pressure. I will slowly deflate and wait for the cessation of the carot cuff sound indicating the diastolic pressure. Okay, 130 over 80. I'm going to now repeat the same thing on the other arm. Can you see me? Really? Palpating the brachial artery. take any additional blood pressure readings in the standing and supine positions as well if necessary. Now I'm going to begin the skin exam, so I'll have you stand up for me. I'm looking at the pigmentation, looking for any discoloration, as well as masses, rashes, and lesions. I'll have you turn around for me. And I'll look at the bottoms of your feet. Good. Okay, you can turn back around. And I'm now going to palpate for temperature, texture, moisture, turgor, and mobility. Okay, now we'll take a look at your fingernails and your toenails as well, looking for any cyanosis, brittleness, lesions, lines, and clubbing. Okay, you can take a seat now. I am going to now begin the head and scalp exam. So first I'm just inspecting the head for position, size, shape, symmetry, contour, and deformities. And I'll inspect the scalp, parting the hair, looking for hair growth pattern, hair texture, lesions, lice, nits, and dandruff. All right. And now you can look at me. I'm inspecting the face for edema, masses, any hair growth and deformities. Now I'm going to palpate the temporal arteries for pulsations and tenderness, the temporomandibular joint for crepitus, deformities, and tenderness. You could open and move your jaw side to side. Good. You could close. I'm palpating the carotid gland for any edema and tenderness. I'm palpating the forehead, the supraorbital ridge, the zygoma, and the mandible for any tenderness as well. Okay, and I'm also, now we'll begin the eye exam. I'm going to inspect the eyebrows, eyelids, and eyelashes for any lesions, erythema, or asymmetry. I'm looking at the eyelids for position and closure, and I'm inspecting the area above the lacrimal apparatus for any edema and lesions. I'm going to palpate over that area for any tenderness, and I'll try to express any discharge from the nasolacrimal duct. Okay, and now I'm going to inspect the vulvar and palpebral conjunctiva for any injection and lesions, as well as the sclera for color, injection, and presence of blood. So I'm going to move your eyelids up and I'll have you look down. Okay, and you can look up. Good. Okay, and now I will assess the near visual acuity. So, let's see, I'll stay on this side. I'll have you hold this straight out. And I'm going to have you cover, your left eye and read the lowest line that you can.
8745.
Okay, and now cover the other eye. Read the lowest line that you can.
8745.
Okay, and now read with both eyes.
8745.
Okay, take this. I would do that with and without corrective lenses. And now I'm just looking for pupil size and symmetry. Okay. Now I'm going to examine the visual field. So I'm going to have you put your hands like this. I'm going to wiggle my fingers around you, and when you see them come into your field of vision, just point at them like this, this, or this. Okay, good. Now I'm going to examine the extraocular muscles. So, okay, I'm going to have you look at the tip of my pen light, and without moving your head, just follow it with your eyes. Okay, and same thing. Right, and I'm just going to have you look at a spot on the wall behind me. I'm gonna move my pen light up in front of your eyes and just switch your focus when you see it. Okay, and same thing, follow the tip of the pen light. Okay, good. Alrighty, and now I'm going to use tangential lighting to assess the cornea and the depth of the anterior chamber. I am looking for any crescent shadows in the medial aspect. Okay, and now I will test the pupillary light reflex, looking for direct and consensual reactions. So just look straight at me. Okay, good. Now I'm looking at the corneal light reflex, looking for symmetry. And I would have the lights dim for this. Okay, I'm going to look in your eyes. So just look straight ahead. I'm looking for the red reflex, following it in, looking at the optic disc and margins, the cup to disc ratio, the retinal arteries, veins, and condition. And you can look into the light now, looking at the macula and fovea. And I'll do the same thing on this side. And now look into the light. Okay. Now I'll begin the ear exam. So first just inspecting the auricle for any deformities, discharge, or lesions. I'm going to palpate the auricle, the tragus, and the mastoid for any tenderness and masses. I'll perform the whisper test, so I'm going to cover one of your ears. I'll whisper something over here and just repeat back what I said.
Cupcake. Pasta.
Okay, good. Now I'm going to take a look in your ears. Okay, so I'm going to pull the auricle back, looking up, and I will be inspecting the external ear canal for cerumen, looking for inflammation, any edema or foreign bodies. And I'm noting that the tympanic membrane is pearly gray, and visualizing the landmarks of the tympanic membrane, including the malleus, umbo, and cone of light. I'll do the same thing on this side. All right. Okay, now we will move into the nose exam. So I'm just inspecting the nose for any physical deformities. We're going to test nasal patency, so I'll have you cover one nostril and take a deep breath in and then out. And then same thing with the other side. Good. Okay, and I am just going to palpate the ridge of the nose and the tip of the nose for any tenderness. And now we'll take a look inside. Okay, so I'm gonna have you tilt your head back. And I'm looking at the nasal mucosa, the turbinates for any polyps, and looking at the nasal septum for deviation or perforation. And then I would palpate the frontal and maxillary sinuses. All right, now I'll begin the oral exam. Okay, so I'll be inspecting the oral cavity, looking at the nasolabial folds, the lips, the buccal mucosa, the gingiva, floor of the mouth, and the teeth. So have you open up for me? Good. Alright, and I'm looking for any inflammation, lesions, and the state of the dentition. I'm also looking at the, open up, posterior pharynx and condition of the tonsils. And now I'm gonna have you stick your tongue out. I'm gonna use my tongue depressor and say ah. Alright, and then I'm noting the phonation and symmetrical rise and fall of the palate and uvula. Let's see. Now I'm going to have you just stick your tongue out for me. I'm noting that it's midline and looking for the color and texture. And now I'm going to palpate the tongue using a gauze. Let me stick your tongue out again. Feeling for any masses and induration. Okay, good. And now I will examine the anterior neck, looking for masses, asymmetry, thyromegaly, and any jugular venous distension. I'm looking at the trachea is midline. I'm palpating as well. I'm looking at the area above the thyroid gland and isthmus, looking for any edema and masses. And I'll have you swallow for me. Okay. And I'm just going to come behind you and palpate the thyroid gland and isthmus. Okay. And displace the trachea. I'll have you swallow. And swallow. Okay. And then swallow one more time. Okay, good. And finally, I'll be looking at the lymph nodes, palpating them with my index and middle finger. So the preauricular, the posterior auricular, the occipital, the tonsillar, submandibular, submental, anterior chain, the posterior chain, and I'll have you turn your head to the side like this, the deep cervical chain, and this side. Okay, and I'll have you take a deep breath in and hold it, and the supraclavicular